Good morning, Arizona.
They don't call it the change for nothing. Menopause can wreak havoc on your body, and it goes further than just hot flashes and mood swings. It can also affect our memory. Dr. Angela DeRosa is here this morning, and you say we can do something about this. We'll talk about doing something about this, but first of all, let's talk about what happens to us. You say that women literally start feeling crazy, like they start forgetting things.
Aside from feeling crazy, we also start to think we're getting Alzheimer's. And what's interesting is that I call it the CRS disease. You can't remember, well, I won't use that word, but stuff. And we often feel that we have a sensor in our tuchus, so the second we sit down, we remember what we came into the room for. But it's unfortunate is that a lot of people, in particular women, as we move through life, we start to decline our hormones. And those hormonal declines, either if they're gradual or if you have a hysterectomy, are very rapid, can make us feel like we're going crazy, but more important that we're losing our minds, that we start to feel old and that we don't remember things anymore. So a lot of women are getting workups for Alzheimer's when they just have plain old simple garden variety hormone deficiencies.
And what are the symptoms? How do you know that it's nothing more than just menopause?
Well, a lot of it, you have to make sure you're doing a good workup. So if someone comes into my office and they're having memory loss, we need to look what we call for the horses versus the zebras. And how we can memory loss in a young 50-year-old woman, Alzheimer's, a zebra. We need to make sure that first their thyroid is well balanced, because thyroid alone in itself can kind of blunt our memory and our ability to recall information. But also estrogen. So I think of estrogen and testosterone, the two big hormones that our ovaries make. They do two different things but work really well together. So estrogen is the gatherer. So in other words, estrogen makes all the communication centers in our brain communicate better to one another. Testosterone is that hunter. So it's specifically targeting the memory centers. So executive function thinking, short-term recall, and those things. But you also need to make sure you're ruling out vitamin D deficiencies, vitamin B12 deficiency, make sure there's no liver or kidney illness. But certainly the most common thing that's going on in menopause or perimenopause is that hormonal decline that's making us feel stupid.
So what can you do? You say hormonal replacement, but are there natural remedies?
Absolutely. Whenever you're replacing hormones, first you need to make sure it's safe. So the best way to do that is by giving hormones non-oral. So in other words, creams, gels, troches, or what we specialize in our office, pellets, which are under the skin, right in the tuchus area. You also want to make sure, aside from being safe, that they're bioidentical. In other words, is it exactly what your ovary once made? 17-beta estradiol, pure testosterone when you replace. And then also looking at the thyroid. There are nice derivatives which are very close to the ones that we make in our body. Armor thyroid, nature thyroid. One's plant-based, one's pig-based.
How early can this start? Can it start in your 30s?
Absolutely it can. I always joke, one of the reasons I got into what I do today with hormones is I started having symptoms in my 20s.
Wow,
and
your 20s?
I went through menopause at 35. I was having symptoms of memory loss and all these other symptoms in my late 20s. People said I was crazy. They made me feel like I was crazy. I know I'm a little crazy, but not
that crazy. We're all a little crazy.
So it really depends on the person, because it can genetically happen earlier for some women.
Wow.
There are things that speed up our hormonal decline, such as smoking, poor diet, being overweight. So there are lots of different things that can make it different times for every person.
So that's good to know. Check with your doctor.
Absolutely.
All right, thank you for that.
You're welcome, Stella.
So now I'm thinking, is it because I'm lacking sleep?
Sleep does it.
What's happening to me?
Sleep is a big play in memory.
That's
so
true.
Get your caffeine.
Thank you so much.
You're welcome.